This episode of ChatGPD was made possible by the hard work and creativity of our production team. A huge thank you to Emily Young, Chris Sang, and Alakia Chandran for their expert production, editing, and behind-the-scenes magic that brings each conversation to life. We also want to thank Sarah Topa and the IMS for their support in helping us share ideas, stories, and resources that empower our grad students at every stage of their journey.
Welcome to another episode of ChatGPD, our podcast on careers in biomedical sciences. I'm Pamela Plant, and I'm with today's guest, Maanik Mehta. Welcome, Maanik.
Thank you for having me. I've not done something like this before, so I'm very excited to be here.
We're excited that you're here as well. So Maanik is our gateway into public health. A lot of our grad students are curious about careers in government and public health. And Maanik has been an employee of Ontario Public Health and is currently an IMS graduate student. So we're going to explore that transition. So can you start, Maanik, by telling us about Ontario Public Health, what their mandate is, what they do, and what your role was?
Yeah, so Public Health Ontario is an independent arm's length organization of the Ontario government. And it's tasked to providing surveillance and health protection and promotion of the province. And so it was created, I think, in the early or late 2000s. And it was created in the wake of many crises, so Walkerton, the first SARS epidemic. And these really underscored the need to have an independent agency dedicated to public health. And so that's sort of where Public Health Ontario came from. It emerged as a branch initially of the Ministry of Health, and now it's its own agency. So of course, it carries with it a very large mandate. And so there are a number of wings operating towards this mission. And so you have your traditional surveillance, epidemiology, outbreak response. But then you also have a very large wing which is dedicated to clinical laboratory testing of communicable diseases. Mm-hmm. So these are diseases of public health concern. And so that's one wing that I was a part of. And another wing I was a part of was public health research. And so I spent about, I worked there for about 4 years, about 3 years in clinical testing and laboratory, and about almost a year in research. So I had a great time there.
So were you involved in COVID testing at all? It sounds like maybe there was timing overlap with that epidemic.
Yeah. So I actually I graduated in 2020 from the University of Toronto Scarborough. And so that was it was the summer, and so I think the pandemic had been declared in March, and so we could talk about that later. But those were crazy times.
And what was your undergraduate in?
It was a specialist in molecular biology and biotechnology.
So you have a very cellular molecular background, not a public health background.
Not a public health
So
background.
can you walk us through the transition from your undergraduate to public health? How did that happen? Because that's a question a lot of grad students ask. How do you get into government jobs? And why public health? Was it an opening? Was there something of interest to you, or what kind of prompted you to do that?
That's a great question. And so for me personally, to be honest, I've sort of been someone that transitions from doing something completely different to the other thing. When I was an undergrad, I had a job working at a school, for example. And so I started doing that, and I thought, I can see myself doing this. This would be nice. And so throughout my career, I've sort of had to pivot a lot and see, I like this one. I had my hands in a bunch of things and to see what I like. I want to know what I like. Mm-hmm. And so when I graduated in 2020, I remember I had a professor telling me, this is not a very good time to be graduating. And it made sense because there's a lockdown. And at the time, the mayhem of the time was we didn't know where things were headed. Mm-hmm. And so I started applying for jobs. I knew grad school was sort of in the back of my mind. I knew I wanted to do it, but I didn't want to do it just for the sake of doing it. And so when I started looking for jobs, I saw postings for Public Health Ontario because they were ramping up their COVID-19 response. And to me, I thought, well, that sounds pretty cool. To be honest, I thought this would be really cool. I want to be able to say later on that I was part of, I was doing something valuable and worthwhile and making an impact, for people. And so, and so I applied to Public Health Ontario, and things worked out. And I started as actually a medical laboratory attendant. in the COVID-19 response team. And so we're involved with testing COVID-19 samples. So a lot of the specimens get sent to Public Health Ontario.
Yeah.
And we do that as a way of not only offering those diagnostic services, but also having those samples so that we can perform surveillance.
So I guess the
yeah.
clinical arm of
Yeah.
public health is
It's probably
kind
the
of
largest
ripe
arm.
for students like you with a molecular background as opposed to a kind of an epidemiology, more public health training.
Yes, I would say,
Yeah.
clinical laboratory, but as well as this research arm, I think what would be great fits. Yeah.
Okay. And then within those, like I'm just thinking, what kind of grad student would thrive in this role, in public health roles? What is the personality? What is the kind of prototype? And then what are kind of the jobs, and how do those jobs progress within public health?
Yeah, so here's the thing. I realize a lot of students, they feel that they need to have certain technical skills, that I need to have experience doing PCR or experience doing that. But these days and age, people and there is a place for technical expertise, right? Nowadays, a lot of people are hired in government, but also academia, such as PIs, if they can fill knowledge gaps in the organization and bridge connections between PIs and research operations. So that has its place. But really what I think public health looks for is how well will you actually perform? Like, what is your potential? And so in that sense, I think having a molecular background definitely helps. In the sense of you can thrive well in clinical testing, you can also thrive well in research. But I think one thing that you have to be is focus on your interpersonal skills. So you have to be bold. You have to know how to communicate. You can have all the knowledge in the world, but if you don't know how to present it, if you don't know how to communicate, then it's I'm sorry to say, but it's not it won't be as helpful.
Yeah, and I think that's a recurring theme on this podcast
Yeah.
is really, it is the transferable skills
Yeah.
or the core competencies that are going to land you the job, not
Absolutely.
necessarily your technical expertise,
Absolutely,
but
yeah.
what kind of a person you are.
Yes. Yeah.
So within public health, there's, I don't know if it's a misperception that some jobs in public health are either boring or, stagnant, or you just kind of go in and you do route work and there's
Yeah.
not a lot of creativity. This is probably a gross misperception of government type work, and
Yeah.
particularly public health. Could you comment on that?
Yeah, so let's approach that question. Number one is Public Health Ontario, as I said, has a very large mandate. So there are just so many things going on, and there are many different fields that you can sort of work in. Now, the other thing is, it's people often ask, how do you actually get involved, right? And so I got started with the clinical side, clinical testing side. And I started as a laboratory attendant, and then I eventually became team lead, and I transitioned from clinical into research as a research technician for Public Health Ontario, their research and development arm. And so when I look at the career trajectory of a lot of people that I work with, none of it's never linear. They always come with very different backgrounds. And so I was working with people, of course, in clinical testing. You need you will do a lot better. You actually need a medical laboratory technician license, so an MLT license for the testing. But there are also a lot of positions within that don't require it. So there are certain managers or operational leads that might not have that background. But yeah, so there are a number of different backgrounds that you will work with. Well, I was working with people that already had their MSc, already had their PhD. In fact, I had a coworker that left to do their master's and then came back. And I thought, I should have done that. That's actually not bad. It's good for professional development and career growth. Yeah.
So is that part of your plan? Why, the big question?
Yeah.
Why come back for your master's?
Yeah.
Why are you not doing a master's of public health?
Right.
And what are your next steps, or do you have your next steps? Where do you want to be after your graduation, and then maybe 5 years after that?
Yeah.
I know there are a lot of questions in there. So sorry.
No, I think when you start grad school right after completing undergrad, it makes sense. That's a linear path. But when you've worked for a while, and you decide to leave or give up a career that you fall in love with, people that you love working with, I think that's a much more active decision. And really, I think what it was a number of reasons. Number one was you come to a point where Public Health Ontario is an organization where when I started was, I'll work here for a bit and then I'll probably transition to grad school once financial conditions improve. But it's an organization, and I think the government as a whole it'll surprise you how much of an impact and how much you can actually do, even if you don't have those paper credentials. But there comes a point where you start asking yourself, how can I be more impactful in this role? And now I'm not saying that you need formal education to do that. You can learn those things just through growth and learning within the organization. But it certainly helps having that formal education. So that's one reason. The other reason is when I was in clinical, as we were winding down and restructuring our COVID-19 operations, I think I had gone through something like 4 or 5 rounds of layoffs. And when you're with because during the pandemic there had been a lot of hires, right? Because to fill the COVID-19 testing capacity needs, right? We were at one point a laboratory that was doing something like 23,000 to 25,000 tests every 24 hours.
Wow.
And so when those needs change, when you're with your coworkers at work, you're talking, okay, we'll get through it. We'll do all these things. We'll plan. When you go home and you have that conversation with your family, like, I don't know what tomorrow might bring. That's very sobering. And it really, you come out of that experience. And I was very fortunate that I was part of the group that was retained, but you come out of that experience saying, I don't want to have to go through that again.
Yeah.
And so
when is my time on the job?
When is your time on? Yeah. And so you start thinking, okay, one way to do that is, giving yourself mobility, right? Things are very great right now, but in the future, if they're not, how do I prepare for that?
Yeah.
How do you pivot? And so that was one reason. And so all these things sort of came together. And when I had the opportunity to do this project, so I work at Sick Kids with Dr. Joy Vincent, and our project is to develop a mouse model for an ocular disease. And so that seems very different from public health. But what really that project gives me is the opportunity to work on those weaknesses that I felt I had. Things like when I had that when I went through that experience, I thought, okay, I definitely need to have mobility. I need to have that opportunity to do more things. So yeah.
So it's just expanding the repertoire of
Yeah.
skill set, expanding, the understanding of molecular world. And do you want to bring it back to public health? Is that ultimately what you want to do? And what I'm hearing is that it's going to be expanding your opportunities within public health and then expanding your impact and reach within public health when you have the graduate degree. So
Absolutely.
probably a little more upward mobility and lateral mobility as well.
Lateral mobility, yeah. Now, I was one of, I think, 12 research technicians that work in Public Health Ontario. And I think I was probably one of 2 or 3 that only had an undergraduate degree.
Okay. Wow.
And
very
so
unique.
the trend is changing that, the government is probably one of the few places where you can join with just an undergraduate degree. But that trend is slowly, I think, changing. I think employers across the board have that soft requirement for a graduate degree. And so I remember one thing that when I was applying, we all go through that. We all start using LinkedIn and we started using our premium trial and whatnot. But when you look at the people that are applying with you, they all are coming from such vast backgrounds, different lenses, and very high credentials. And so that's a pool that you find yourself in when you're applying. And so what you have to do is you have to find someone that believes in you. And so I was very lucky that I found someone that believed in me, right? I'm not an individual product. I'm the product of multiple people coming together and multiple things going right. And so that has to work out as well, I think.
Can you explain that a little
Yeah.
bit more? Who
Yeah.
was that champion?
Yeah.
Were they in the government at the time?
Yeah.
How did you seek them out?
Yeah.
Was it somebody you were previously connected with?
Yeah.
And what was that?
So that's a good point, because when I started with Public Health Ontario, I had no connections, right? There were some people that knew each other, and but really I was completely outside of the world of public health when I came in. And so I think one of the things that you do is once you get in, people think networking is just for business, for people in business. Networking is everywhere. And as much as, and you may not like it, you may actually enjoy that part where you talk with people and get to learn their story. But it's very important. And when you are hired along with something like 400 technicians, that question is, how do you stand out? And so one of the things I did was, first of all, have those soft skills, be kind, be nice. But also one of the things I started doing was I knew I wanted some skills I wanted to improve. So these were computer programming, for example. And so I started taking on initiatives within my job. So these were things that were outside of my job that I was working on, right? Skunk work projects, if you will. And so, of course, right now I think automation and digitization is a big. It can make a very big impact in clinical laboratory testing. And so I started making programs, softwares that could help the laboratory. And once you do that, then you become known as, oh, this is someone that can help in these areas, and word travels fast, and then you start helping and get collaborating with other projects, and then from there you start getting new opportunities, and that's, I think, one of the things that's very helpful. Another thing is Public Health Ontario is a strongly unionized environment. And I think a lot of people don't realize how powerful that can be, working in an environment where you are standing behind a collective bargaining agreement. But that also means that oftentimes internal candidates can be favored. And so a case has to be made for, if you're an external employee and you want a job that requires a very common skill, a case has to be made for why you and why not someone else that it's already in the organization has put in the years. And so I think it goes back to what I was saying before. If you have those technical skills, if you have expertise in an area that is a gap within the organization, it makes you a very powerful candidate. Yeah.
I think that's, again, a theme that always comes up
Yeah.
when I say to students, you've got to outwork everyone. And I don't
Yeah.
mean outwork in the number of hours
No,
you
yeah.
work. Expand your horizon, intuit the needs of the organization, and
Yeah.
fill those before the organization realizes it's a need.
Yes.
So really do a little bit of a scan of your environment
Yeah.
and look for holes,
Yeah.
and then seek the skills that are going to fill those holes.
Absolutely.
And get there first. Like that's a
Absolutely.
really powerful thing to do and make you stand out.
Yeah.
But I want to go back to students that may want to get into government. It sounds like timing was on your side.
Timing was on my side, yeah.
It was like a blitzkrieg approach to hiring.
Yeah.
Let's get as many people as we can. You were onboarded in a time that probably won't be recapitulated, at least for hopefully the not near future.
Yeah.
What advice would you give to students that want to kind of get into the public health stream
Yeah.
without being on the tails of an epidemic to get there?
Right. So the advice I would give is go to wherever it is they're doing what you want to do, right? And so try to find ways to get involved and understand how the system works, right? And so there are a number of resources. I think one is developing those skills that you will need in public health. And so communication is one, but of course that applies everywhere. Knowledge synthesis and knowledge translation is another big area. And so I think you mentioned like the U of T library offers a lot of resources in developing reviews and knowledge synthesis. I think those are very helpful.
Like systematic reviews.
Systematic reviews, yeah.
Okay.
Yeah. So those are big. And then I think I would also like to mention, so PHO has rounds that they publish on YouTube every month, and so that's a great way to understand the kind of work that gets done at PHO. These are rounds. They
Is
have
that just Public Health Ontario on YouTube?
on
It's
YouTube,
just-
yeah.
Or
yeah.
is it PHO YouTube?
I think it was probably Public Health Ontario on
Okay,
YouTube, yeah. And so
great.
there are rounds or microbiology rounds, and that gives you a really good insight into the type of work that people do. The other thing is understanding the organizational structure, right? So if you're interested in getting into research, when I was there, the way it worked was that if you're a research technician, you would be typically working closely with one or two PIs. And these PIs would be responsible for conceiving ideas and for research. They each have their own portfolio. And so and they work under that portfolio to start research projects. And so you're responsible for helping execute, coordinate, and from the beginning to end of that project. So that's pretty unique. And what it means to be a research technician and do research in PHO is quite different from other organizations where you might just be responsible for doing one task and that's it. But from PHO, depending on the PI that you worked with, you can be assigned. You could really there would be one day where you're doing paperwork, you're reviewing legal agreements, but you're also doing the wet lab, the bench stuff. And then you're also doing the analysis, and then you're disseminating that research as well. So you really get a whole a broad overview of research, of the research life, I think. Yeah.
So what would you recommend for students to kind of scratch at that surface and get in? Like, would they reach out to PIs that are doing public health oriented research? Is this, in the mainstream literature? They could seek that, aside from watching the YouTube videos, are there any public facing events or groups or think tanks or organizations they can volunteer with to kind of tangentially access public health, to network and get in the inner circles? Is there anything that you would recommend?
So I would say Public Health Ontario's recruitment is quite traditional in the sense that most candidates are hired just simply through job
Their
postings
website,
and through
yeah.
website. Yeah.
So they have a Public Health Ontario come and work for us
Yeah.
on the
Yes,
web.
yeah, on
Okay.
LinkedIn, on any social media, they'll have their postings there.
Okay.
And so that's one of the most, I think, common ways I've seen students get applied. Now, if you're in clinical, I think there are a lot of programs that will give you an experience through rotations. And so a lot of students go to the Michener Institute to get their MLT license. And through that, they get to work, get experience in Public Health Ontario, make contacts and connections there. And whenever there is room for an opening, you have to, the other thing about your network is that, just establishing and keeping the network there isn't enough. That's something that requires a lot of work and you have to maintain it.
Yeah.
And
Like
so,
any network, you've
like
got
any-
to keep it warm.
yeah, to keep it warm. Yeah. And so, and these, and so to stay, yeah, so you have to stay in that environment. Yeah.
Okay, I would love to know what advice you would give to students that are trying to decide between public health roles within the government and versus private institutions. What are the benefits?
Yeah.
What do you see as kind of the optimal reason somebody would choose careers in public health?
Yeah, that's a great question. I would say, one, I mentioned this before, but working in a unionized environment, I think, versus is something that is very underrated, I think. And because your union dictates, I mean, of course, I'm in a union right now, and it's a student union. But your union dictates so much. That includes, these are things that have been fought for in the past, such as your salary, your wages, your benefits, and your work-life balance. And so that's one thing that I think government has over the private sector, not just competitive, but actually in a lot of sense better. So that's one thing. The other thing is PHO. We collaborate a lot with universities, other public health organizations, the NML, the National Federal Public Health Organization. And the reason being is that because we test so many samples, if you have an idea for a research project, chances are we already have everything on site to actually facilitate that research. Not only that, the expertise is also on site. If you're looking for a very niche a method or technique, or you need training, chances are there's someone, because the organization is so big, and the chances are that there's someone already there that is doing that kind of work. And so training and development and growth is very easy in that sense, that people are very open to train you, and you work in a very multidisciplinary environment. Yeah.
Do you know much about the Masters in Public Health and how it differs from, say, what you're doing
Yeah.
in your graduate work in IMS? And I'd like to know, again, why IMS? I know you
Yeah.
wanted that breadth.
Yeah.
But what are some of the things that you're picking up specifically in the IMS degree? And maybe it doesn't even have to be curricular, it can be extracurricular.
Right.
What are some of the opportunities that you see are going to grow you into the optimal person to progress in the public health sphere?
Yeah, absolutely. So, when I finished my undergrad, of course, just like any other student, I was looking for, what am I going to do? And if I do a master's, what sort of program do I want to see myself doing? And so, one of those, so I did consider Masters of Public Health. I also considered there's a Master of Biotechnology program as well. And these are all great, but, one thing that I think IMS is doing really well is prioritizing not just a student's technical research skills, but what else does a student need? How else do you make that big package? What are the unmet needs that employers want? What are the unmet needs of students? And I think if you look at, I was looking at the MSc Futures Project, which I know you're also a part of. But when you look at it, I think about the students who do complete their masters and enter the workforce. I think about 60% of them are going into public service, right? So that's a two-way street. I think it signals that IMS is doing something very right in creating and training competitive candidates that excel in the public service. And I think one of that relates to is honing those core competencies. So honing those communication skills, understanding what it is that students need. And so again, I said this before, but you can have all the technical expertise in the world, but if you don't know how to communicate it, Public Health Ontario is a job where you can go from explaining something very, very technical to a scientific audience, and then 5 minutes later going and explaining to an external stakeholder or liaising with someone that is not involved. So you might go to financial services or legal services and explaining your work to them. And so knowing how to pivot and having those skills, I think is something that IMS is really, really great at. And so for me, when I was doing my undergrad, I was in the co-op program. And so I got a chance to work at Sick Kids. And over there, our students were, the graduate students at the time were also in IMS. And so one of the things that they would do is they would take us to events. And so we got to see a lot of the mission of IMS. And I think that's one thing that the program does very well is in its messaging, that what can it do for students and what kind of students are we creating?
So I love how you spoke to the IMS really affording opportunities for grad student to develop themselves as workers as
Right.
opposed to graduate students,
Right.
and really providing so many opportunities for growth and discovery and developing core competencies in a non-traditional kind of technical laboratory setting.
Right.
How are you personally exploiting that, or for yourself, are you seeking out any new opportunities? Have you developed any meaningful engagements that are developing those skills? Could you speak to that?
Yeah, sure.
During your time in IMS?
Sure. One of the things I really wanted to do was learn, was really refine and learn public speaking. And so I think this is advice for any new graduate student, especially in their first year like I am, is to speak everywhere. Speak everywhere you can, get your message out, learn, and it won't always go well. But you will definitely, people will only care about the finished product. People won't remember exactly what you say, but they'll remember how you said it.
Right.
And so for me, I've been trying to work, and that's actually one of the reasons I have to shout out GPD for helping me with that.
That's the graduate professional development foundational course that we teach.
Yes, and it's also been expanding as well. So that's great. I think because it comes down to this is why we're doing it, right? I think for me, I also fall into this trap as well, where you begin thinking your project is everything. And don't get me wrong, your project is very, very important. The work we're doing makes a difference. But you also don't want to graduate and think, okay, what else do I have going on? Because you may not, like me, you may graduate and work in a career that's completely different. And if you are just only honing those technical expertise, those technical skills, how to do a Western or how to do PCR or how to do this method, and you don't have anything else, that will really come back to bite you. I think so. So for me, it's been speaking, engaging in any event I can.
And
has been very
what does
helpful.
that look like for you?
So
Research day, or is
research day,
yeah.
or there can be posters or invited talks. But also go to them and learn how other people do it, how people speak. Pick up on that as well. And I think just being in that environment really, really helps. And you won't realize it until you see the final product, but it really helps.
That's a good plug for our scientific communications course that we are going to be running this fall.
Yes.
Because it is such an important skill for students to develop, and not just public speaking, but all forms of communication. Exquisite writing. It could be podcasts. It
Right.
can be LinkedIn posts.
Right.
How do you convey your brand
Yeah.
and your message, and really, this is so important going forward as you're progressing in your career, because
Absolutely.
this is what people will see and base their opinion about you
Yes.
on.
Yeah.
So the more you hone that message and make it precise and acute, I think the better you will be.
That was also one of the things I was worried about having worked so long and not been in school. I probably, when you're an undergrad, you're used to giving a lot of these formal talks. You're used to taking classes. So how will that, transition from working for so long to school be? But so I think tackling those things early as well. Some people think that GPD, professional development, is only when you're about to graduate, but that process begins now.
Yes.
Because if you do not, if you don't know what you want to do, some of the best advice I was given was know exactly what you want to do. And that was by my PI when I was in Public Health Ontario. So I want to shout out Dr. Vanessa Tran for helping me. But it's very true, because you won't realize how even the smallest decision may screen you out of potential opportunities in the future. And so I'm not saying do exactly that, know what you want to do and then do exactly that. You can, develop those skills that will make you open to a bunch of industries and even within academia. But by knowing what you want to do, you have a plan in mind and you have goals. And when you set those goals, make sure they're not realistic goals. I would say that.
That's another great piece of advice.
Yeah.
If your goals are realistic, they're not big enough.
They're not big enough, and you'll probably get there. You'll probably do it. But if you had set a higher goal, you'd probably be somewhere in the middle. And that's
I
better
think it's
than-
important to have all gradations of goals,
Yeah.
because it is good to have achievable goals
Yeah.
as well,
Yeah.
because you have to maintain your mental health.
Right,
So
yeah.
when you have wins that
Yeah.
you are kind of running with,
Yeah.
it helps you achieve bigger goals.
Yes,
Because
yeah.
it's the loftier things that require a lot of resilience
Yes.
and fortitude. And I think you build that by having small achievable wins along the
Absolutely.
way as well. But aside from communication, what are some of the transferable skills that you think are most impactful in public health?
Problem solving.
Yeah.
So I know a lot of people think that public health is a very routine job, and I know it's been said on this podcast a lot. No day is the same. Even in clinical, I would say. In clinical, the work itself might be, the structure itself might be routine, but I think having a broad knowledge base really helps, because you can be adaptable to any sort of laboratory setting. And so there are labs, so the way Public Health in Ontario is divided is that you'll have a laboratory that tests this group of infectious diseases, right? So you might have a laboratory for COVID-19 testing, you might have a laboratory for TB, tuberculosis. And so having that broad knowledge, but also when I was a team lead at Public Health Ontario, I was a team lead of a laboratory known as the Amplitude platform, and this was a highly automated and robotic platform that was designed for high throughput, large volume COVID-19 testing, and this was something that hadn't really been done before in the past. And I think it's fair to say we were the largest single site COVID-19 testing operation in Canada. And so what that means is that a lot of these instruments that we were using were novel. This was a platform that was specifically put together in the wake of the pandemic and put together very quickly. And so, even by the time that we were winding down operations, every single day you would still see a new problem, a new error pop up on screen. And so that can be in a way stressful, because how do you keep a large part of the province's operations going when everything is paused and halted and you might have to shut down? So I think being able to problem solve, but also stay calm in those events, I think those are also very big skills to have for public health. Also, I would say in terms of technical, I know I said it before, but knowledge synthesis. Every single day you need to be able to synthesize papers, make informed decisions that are backed by evidence, because that's what we're doing. We're providing technical and scientific expertise to stakeholders within the government, and that informs policy making and planning for the public health of all of Ontario. So it is, the stakes are there, and you need to make sure that you're able to make those informed decisions.
So it does sound like it's a perfect position for a master's or a PhD
Absolutely.
in biomedical science, because those are skills that you develop in spades when you're doing in the course of your degree.
Absolutely, yeah. The other thing I would say is, this might not be a skill that you see on the top 10 skills to have, but be bold. For me, it was the best. It was when I joined my lab now, it was music to my ears to hear, this is your project, run with it. And so when you do that, you really innovate. You really push the barrier, and when it relates back to setting those realistic goals. If you run with it and you're really enthusiastic about the work you want to do, the end product will be something a lot better than just if you were to do the bare minimum. So do that. Have that hunger, I think. Yeah.
It's great advice.
Yeah.
And just in terms of like knowing public health, what are the big themes? And can you maybe just touch on some of those? What are the big themes that are current, and what are the big themes that are emerging in public health to help students kind of begin to synthesize those areas of knowledge and seek the knowledge in those areas? What would your opinion be about those?
Yeah, I think, well, I mean, I would be remiss if I didn't mention it, but AI, I mean, is one big
of
thing,
course, yeah.
Automation, digitization. Oftentimes, if you know computer programming skills, if you know how to code in a certain language, it's a very, very powerful asset to have in an organization that's constantly digitizing and modernizing their infrastructure. And I would say, I think taking classes, unfortunately, like programming classes, is simply not enough. Because it's very hard to apply generic principles and generic lessons to very specific problems.
Yeah, you need to contextualize it.
So I think the best way to demonstrate yourself is by doing coding projects, and by doing your own, if you see a problem, think about how can you fix it? How can I maybe make a software that makes things better? Things like that are very important to have on your CV, and employers will notice that. Yeah.
And then what about in the future? I mean, AI, it's a given.
Yeah.
It's going to affect every industry. But in terms of public health, like, is it disease surveillance? Is it kind of emergency preparedness?
Yeah.
Is it, environmental toxins? What do you see are the biggest themes and challenges for public health right now?
Yeah, I think, well, I can speak on my experience, and that would be, I think, surveillance of emerging threats. And through that is whole genome sequencing. So I think whole genome sequencing has made a very, very big role in how we test our diseases. So right now, things are limited to PCR or some routine surveillance. But I think WGS, if we can scale those costs down, has, if you could think about it, if we could whole genome sequence every single test that we receive, we would get the whole picture. And that's very powerful data to have. And so having that background, but also being able to analyze it, I think is probably where Public Health Ontario is headed. Yeah, if I had to
think
guess.
that's true for disease monitoring, but also environmental monitoring as well for different threats.
Yeah.
So we're just going to wrap up, and I would like you to wrap up by doing 1 minute or so pitch to all of our listeners of why public health, why a career in public health, why should they take their degrees and go into government work.
Okay, absolutely.
We will start you right now.
Sure. So Public Health Ontario is a lot more than just sitting down and crunching numbers, right? Public Health Ontario has so much going on. It really is an ecosystem. And so I know that sounds like a buzzword, but it's so true that there are multiple ways that you can get in touch. There are multiple backgrounds. There are people with so many different backgrounds that come together to create this mission. And so I think, for me, I mean, taking in that I'm currently in grad school, but I would love to go back. Right. And so I think that is case in point as well. But also, if you have these ideas, if you have research, one of the best ways to facilitate it is Public Health Ontario. It would be very common where I would just walk in to my PA and say, hey, I have this idea or I want to do this. And they'd be like, great, do it. We have, you have our support. And that was the best feeling ever. So that support is there. The structure is there. And I think PHO is on to very, very exciting things. And you definitely want to be part of that because you get to impact the health of all of Ontarians.
And have a stable job.
And have a stable job, yes. Yeah.
That's great. Thank you, Maanik. It's
course,
been
it's
so
great.
enlightening. And I think one thing that I've really taken from this is there is so much more the nature of positions in public health are so much more dynamic
Right.
than one might suppose. So
Right, yeah.
I think that has been a very important lesson for me. So thank you for shedding light on that. And we'll look forward to seeing you progress in IMS and then perhaps have you back when you transition back into public health
That
in
would be
your
cool.
higher up roles.
Listen, I've been really enjoying the show, and I really mean that. I think some of the, a lot of the advice that has been given is something that directly impacts a lot of students. And I think it's going to start getting students to think about what they want to do after graduating early. And
yeah.
I think that's the most important message that that we can convey. So thank you for having me. This has been great. And in a way, this is also ChatGPT's inaugural year. So it'll be exciting to see where how this grows, and it is already growing. But yeah, I think IMS is on to very great things. So
Oh, thanks,
Yeah.
Maanik. Take care.